Did you know that nothing ever gets done without first making a commitment? Think about it. If you're a dentist, you first had to commit to go to high school, then college, then taking your boards, then studying, etc. Or if you're an athlete, if you've run a marathon, or even just done a 10K, or even just went to the gym, you first have to commit to get out of bed and go to the gym in the morning. Doesn't mean it's going to get done, but it's the first step. One of my mentors, Dan Sullivan, talks about the importance of commitment. It's not easy, but after commitment, you get the courage to go through it, and then you get the capability, and then you get the confidence. He calls it the 4 C's, and we'll talk about that again some other time. Today, I just want to talk about commitment. A number of years ago, one of my mentors, P.D. Miller, the father of periodontal plastic surgery, saw me give a lecture at the International Society of Periodontal Plastic Surgeons at our meeting of the American Academy of Periodontology. And I wrote an article since, but the lecture that I gave was on keeping people's teeth for 30 years that had severe periodontal disease in the anterior aesthetic zone. And PD came up to me after the lecture, and this was about 15 years ago. He says, "Mike, I really liked your lecture. You should write that up." And I said, "Sure, I'll do that." I did not commit. I just said, "Sure, I'll do that." And I had no intention of doing the writing, because I really don't like to write clinical articles that much. They're hard for me to do. Well, about a week later, 2 weeks later, I'm at home on Sunday working on a lecture, and P.D. Miller calls me up, and he says, "Mike, how you doing?" I go, "Good." Now, for me, P.D. Miller is he's an icon. He's one of my mentors. He's 20 years older than me. He's someone that I've revered since I was in my early 30s, and now I'm at 60 and he's 80. And he's calling me on a Sunday morning, so it's a great honor. And he says to me, he goes, "How's that lecture coming?" I said, "The lecture's done." He goes, "I mean the article." He goes, "I haven't written it yet." He says, "Well, are you going to write it?" He goes, "Yeah, I told you I would." And I smiled to myself. I smiled because here's an 80-year-old calling a 60-year-old on a Sunday morning asking him to write an article. I mean, that's a commitment on his part. He says, "I like a commitment." And so I said, I'll get it done. He goes, "That's not a commitment." I said, "Okay, PD, I commit to writing the article." He goes, "No, that's not a commitment." He goes, "Mike, this is a commitment." He goes, "I, Michael Sonic, commit to you, Dr. P.D. Miller, to write an article within the next 4 weeks and have it delivered to my office." I said, "Okay." He goes, "Now say it." And I did. "I, Michael Sonic, commit to you, P.D. Miller, to write this article and to get it to your office in 4 weeks." And 2 weeks later, it was in his office. And about 4 months later, it was finally published. And I would have never published that article unless P.D. Miller called me up to make a commitment. Now, why do I tell you that story? I tell it to you because it really started to generate me an idea that maybe I should use that commitment with all of my new patients. So when a new patient comes into my office that's going to need comprehensive care, that's going to require maintenance, which is most of my patients. They have periodontal disease, they lost teeth, they need implants. And one of the most important aspects to maintain teeth on a long-term basis is maintenance. I will tell them to commit to me to getting their teeth clean every 3 months. Now this is something that's a little unusual. How often has a patient, or you as a patient, gone to a doctor for any reason and had the doctor ask you to commit, "I'm not going to eat sugar anymore, I'm going to exercise 4 times a week, I'm going to get 8 hours of sleep a day, I'm going to drink 6 glasses of water"? How often has that been done? It's never been done to me. Not ever has a doctor had me commit. Now in high school I had some coaches that made me commit to do some training, but they were coaches that were specifically designed to do that. We are the coaches for our patients. That's our job. I'm an oral hygiene coach. It's probably the most important job I have. So at every patient's initial visit, after I do them the exam and after I tell them the treatment plan, I'll say to them, "Do you commit to getting your teeth cleaned every 3 months for the rest of your life, whether it's in my office or in the office of another competent periodontist or restorative dentist?" And they say yes. And I say, "That's not a commitment." And then they say, "I commit." And then I say, "That's not a commitment." And they go, "What do you want from me?" I go, "I want you to say this. I, John Doe, commit to you, Dr. Michael Sonic, to get my teeth cleaned every 3 months for the rest of my life." And then we smile. I said, "Thank you." And that's the first visit. We haven't even treated them yet. And after treatment, when I reevaluate them and I put them on recall, At that point in time, I go, do you commit to getting your teeth clean? And guess what they do? They start laughing because they remember that first visit, because for them it was a significant emotional event, because perhaps it was the first time in their lives anybody actually asked them to commit to taking better care of themselves. And I use this coaching practice in every area of my life, whether it's with my children, with my friends, colleagues. I ask them, do you commit? If you want some coaching from me, do you commit to follow this advice? Because without a commitment, you're never going to get anywhere. It's the first step. It's the first step if you're going to become capable and develop confidence when anything is to commit. And it requires courage, and it's not easy. But it also requires a little bit of courage on my side to be able to take the time to do that for them. It's an important skill that I recommend all of you learn if you want your patients to have better oral health, to maintain their teeth, and for the work that you do for them to last. Because isn't that why we're doing it? To be the gift to our patients on a long-term basis? I hope that helps you. And remember, be the gift to your patients and to everyone in your lives.